Hi there, I am Jenny Steenhouse, the developer advocate for Neosensory, and welcome to Research Design with Mike Perrotta. This event is part of our community research program. If you'd like to find out more, please visit neosensory.com/developers. Developed by neuroscientists, Neosensory builds non-invasive brain-machine interfaces to create new sensors. Our research began with the idea that our experience of reality can go beyond our sensory limitations. Mike is a neuroscientist, writer, and engineer. One of his favorite aspects of working at Neosensory is combining all of these skills. He's experienced in a broad range of topics from user research, audio processing, and VR, AR development, data visualization, algorithmic design, science writing, rapid prototyping, and management. Mike also brews a mean keg of kombucha. And with that, Mike, I'll hand it over to you.
Thanks so much, Jenny, for the introduction. So as Jenny said, I'm Mike. I'm Chief Science Officer at Neosensory. I joined when the company started 7 years ago. So they hired me as somebody to run the science studies for the company, and there were just 3 of us in the office. At that point, we've grown to 25 people, more or less now. And so it's been great to see the growth. We're still small. And so over those 7 years, I've had the fun challenge of running science studies as a small group rather than as a large academic institution. And so a lot of what I want to talk about today is how you as an individual or as a small group can run a study. And so we'll dive into this. I want to start though by just getting an idea of who you all are. We can keep this casual, we can make this tailored to you all. Either feel free to throw it in the chat or unmute yourself and say if anyone wants to volunteer who they are, if you're working on something, what are you building, what do you want to test, what do you want to learn today, are you an individual, are you with a small team, anything like that. And that said, I can't see the chat, so.
I can keep an eye on the chat for you, Mike.
Thanks, Jenny. So, right, so some folks on the community team, the community research that Jenny's been doing an awesome job working on. So thanks, Andrew, you're with the continuous glucose monitoring team. If anyone doesn't know, Neosensory's developer community is helping teams work with our hardware on different projects. And then Leanne, just a person interested in research studies, nothing specific. Cool. Yeah, thanks for that. So at any point during this presentation, feel free to ask questions. We'll also have time for questions at the end. So if you have if something comes up and you say, ooh, for my research, how would I do this specific thing? Just because there are so many broad ways. So we'll work with some examples here and cover a lot of things, but of course, there's always specifics that if you think I'm still not sure how to do this, something I want to do, save that as a question and we can get to that. So before we dive into the specifics of research design, I just want to really emphasize what I think is one of the most important parts of developing a product, which is just to test as much as you can. So before you make anything, before you work on the actual product, you should be testing it. And that's not always a science test. Maybe that's a user test or a market test where you're going out and saying, would somebody like this? Maybe you make a simple website that advertises your product and you haven't made it yet, but you're going to see who would buy it. Can anyone sign up for pre-sales, even though we haven't made something yet? Because otherwise, as happens so often, you might end up putting a lot of time and effort into a product that's not something that should be built. There's something else that should be built instead. So be really intentional about testing as early as you can. And then once you do build a product, don't make it sleek. If you're testing with a product that looks really nice, then you've developed it too much. So you should have your minimum viable product prototype, and you should be going out the door with that and getting it on as many people as you can as early as you can. So I can't stress that enough. And then of course, continue testing and be open to those test results. So don't just test just to go through the motions and then stick with the solution you had in your head. Be open to saying, oh, you know what? The result of that test, maybe I should be doing something a little bit differently. So for instance, when I joined Neosensory 7 years ago, we were making a vest that had 32 motors on it. So it could transmit a lot more information than our wristband now, which has just 4 motors on it. And through testing, through user research, we found, hey, people don't want to wear a vest all that much. They'd rather wear a wristband. And the deaf community isn't as doesn't care as much about hearing speech. They want to hear environmental information. And so those were huge results that we frankly should have found out even sooner. And so we totally switched our product and started making a wristband instead. So just really want to stress that everyone should test as now, of course, we can break those tests into 2 types. So one of those is user research. So do your users like the product? You don't even have to have a product, like I said, but do your users like the product? You do need to know who the customers are. So this will help you define, what are you building? Why are you building it? And so this is super important. I'm not going to focus on user research. Today, we're talking about science research, but because it's so important and just often a failure point for product development, I just had to emphasize that. Science research, on the other hand, is, does the product work? So can we prove that this product works? So of course, you do need the product for that. You need to know, what do you mean by work? So what is your product trying to do? Define what it means to say the product works. And that's what we're going to be making sure that we have a rigorous scientific process so that we know if it's working or not, and we can trust that result. For instance, though, Theranos, Elizabeth Holmes had good user research. People were very excited. They raised billions of dollars, but they had poor science research. They didn't have a product that actually worked. So both of these are very important types of tests, and we will be talking about the science tests. So who cares? Why are we doing this science research? Answering this question, there's different answers for different people depending on what your goal is, and answering this will help you shape what your study will look like. So it might be that you're doing science just to prove to your team that your product works. It might just be internal validation. You might not ever want to or intend to publish that data, and that's fine. You can still do valid scientific studies that prove to yourself that your product works. Or maybe you're not publishing the data, but you want to show investors, hey, we have data, this works, we can show it to you. That doesn't have to be published in a journal. And we'll talk more about the different places to publish and how that looks. Or you might be at the point where you want to use this for marketing. And in that case, you probably would want to publish it. Then you're saying to your customers, hey, we do know that this works. We can show you why. Or maybe you're doing it for more of a general scientific knowledge and you want to contribute to the scientific community, especially for sensory substitution. So this is very important to know. At different stages, your answer will be different. So maybe when you first start, you're just trying to say, does this work at all? And that study will look very different than a study that you're trying to get published in a journal so that you can use it for marketing and whatnot. So to dive into this, let's do an example product. So we are at Neosensory developing a balance device. So it has a collar clip that has a motion sensor, so you know where somebody's balance is, and it has the wristband connected to that. And so when they are in their baseline orientation, there's no vibrations. And then as they tilt away from baseline, the vibrations increase more. And our hope is that we can help people who have balance disorders to add this new sense or add to their damaged sense of balance so that they have fewer falls and better posture and balance. So this is for people with vestibular damage, so people whose inner ears are damaged and their balance organ is not working. So if we were to want to prove that this works, where would we start? We are going to, first of all, do a literature review. So there's a lot of science out there. It's important to go make sure you're looking at that. How can you access this? This is one of the biggest downsides of being an individual or a small group is that these journals cost a whole lot to get access to. And if you're not part of an academic institution, then it's a little bit harder to get this. Whereas if you're part of an academic institution, that usually comes with access to many journals. So thankfully, there are more and more open access journals. So make sure you look at that. You might find that there is stuff published that you just have access to. Otherwise, you'll be able to find the abstract, which, if you don't know, is the short paragraph that summarizes the whole study and is always open to anyone, even if you don't have access to the paper. So if you find an abstract and you say, ooh, this is a paper that would be really helpful. It talks all about balance and it's a previous balance sensory substitution paper. Reach out to the authors, and there's usually a correspondence email. You also might try different authors on there. So the principal investigator is often the last name on the paper, and they might not have as much time as the grad student who was actually doing all of the work, who might be very excited to have a conversation with you about their work. So reach out to a few of the different names there. After your literature review, you just want to make sure that you have a well-defined hypothesis. And so we can talk about both a general and a specific hypothesis. So maybe for our balance device, our general hypothesis is that this device is going to help people with balance disorders to not fall as often. But we also want a very specific hypothesis that can be tested with a specific test. So, this balance device will help people score higher on this metric that is anchored in their ability to stay upright. So a specific outcome measure. So you do need to find out what your outcome measures are at this point in the study when you're designing it. The best way to do this is to, if you can, find a standardized test. So for instance, there are standardized tests that people have made to measure how balanced somebody is. And so when you're doing your literature review, maybe you come across all these papers that say, we used this test, and there are tests in this case for balance. And it'd be great if you use the same ones, because then you can, one, have trust in that study, and two, you can compare to other people's studies. So sometimes you do have to make your own tests, but it's really great if you are able to find a test that fits your hypothesis that you can use. And the other thing to keep in mind here is that you can do both objective and subjective tests. So an objective measure is one that's going to have a number. It doesn't have to do with asking somebody their opinion. So if there's a test that says, okay, wear a motion detector and we're going to come up with a single number that represents how wobbly you are, that's an objective test. That's very solid. If we say, give somebody a questionnaire that asks them questions about how balanced do you feel, how confident do you feel, how confident do you feel while you're walking, those are also very valid and helpful. Those are subjective tests. And of course, those have some downsides that people, in that people can kind of be swayed one way or another. They might want to say that they're more confident in their posture, whereas an objective test, it's whether or not their posture is actually improved. So it's always great to include both. There's no reason to not include subjective tests, but as much as you can, objective tests do have a little bit more power and are a little more convincing. So I want to real quickly go over psychometric studies. So this is a little bit different than this big picture. Does somebody, can somebody balance better with this device, or can somebody hear environmental sounds with the Buzz wristband? Instead, this is, what does somebody feel? Psychometric studies look at any sensory input. So it might be, what can you distinguish when you're looking at an eye chart? That's a type of psychometric study. If you're working with our vibrating wristband, then you might want to do psychometric studies on what vibrations can people distinguish. So maybe you have different intensity vibrations and you want to know, can somebody tell a 55 from a 56? And so there's a couple, I'm not going to dive too deeply into this, but I just want to put out onto the page a couple of different ways that you can test those things. So the first one is called two alternative forced choice. So this is, you give what it sounds like, you give two choices and the person has to choose one or the other. They can't say, I don't know. So maybe you say, you give them 2 vibrations and you say, was the first one stronger or was the second one stronger? And they have to guess. And so if those vibrations are so close in intensity that they can't distinguish them, then they're going to be at 50% on their answers. They're going to get it right half the time and wrong half the time. If those vibrations are far enough apart, then they'll be getting it right closer to 100%. And so you can measure all of these different distances in intensity, and you can come up with a curve that shows you when are people confident, when are we confident people will know the difference between these 2 vibrations, and when are we not. Just noticeable difference is another way. It's very similar, but instead you play the 2 vibrations and you say, were they the same or different? So it doesn't matter if they were stronger or weaker. So there's a little bit of a different analysis here, but very similar. And then you also might want to find what is the threshold? What's the weakest vibration somebody can feel? And so you can just play a lot of different vibrations and say, when can you feel this? And so because this is a specific type of test, I just wanted to put this up here, and you can go either ask us more questions later or dive into this. If you are doing a threshold detection, you could definitely look up adaptive functions. They're very smart ways to find the threshold level very quickly, such as the Quest algorithm. But again, I'm not going to get into that right now. So zooming back out, let's look at a paradigm that we might create for this balance device. So the paradigm is if you don't know, if you're not familiar with that word, that just means what is the structure of the test? What are you doing? It's kind of a almost an umbrella term for all of the parts of your study and how that looks. What is the design of the study? So we already talked about the outcome measures. We have, let's say we have an objective test and a subjective test that ask about somebody's ability to stay upright. But then are we having somebody come into the office for a single day and testing them, or do they take home this device to train with it? Do they test every couple of days? Do they test once at the beginning, once at the end? All of those things are questions you have to ask yourself. And this is going to be very specific to what you're trying to study. But yeah, you need to come up with exactly what is the best way to answer that hypothesis. Now, the other very important thing that folks are probably familiar with, but we'll go into the details of, is how do you control your study? So can we have a control condition that proves whether or not your results are due to your product? So maybe we don't do a control condition. We get a whole bunch of people to wear our balance device, and at the end of the 2 weeks of them wearing it, we test them on the same test as the first day, and we say, oh my God, everyone is much better at staying upright and balanced. That's excellent. But we don't know if that's because they are actually getting better because of our device, or maybe there's a placebo effect. So this, of course, is they want to, one way to think about it is they want to think that this was working. They know they are wearing something that should be helping them. And this often, you would want to know if the results are just due to placebo effect, because oftentimes those will not last for very long. And why would you try to sell a device that is just a placebo? Because you can also get the same results from a much cheaper device that doesn't do anything. There's also a training effect. So maybe it's not the placebo, maybe they're actually getting better. It's not just that they want to believe it, but maybe every, let's say our paradigm is such that every 3 days we have them take this test that says, okay, stand on one foot and let's see how balanced you are. Well, if I take a group of people and I tell them, hey, every 3 days, stand on one foot for 10 minutes and see how balanced you are, they might get better at that just by doing it. So we need a control condition to make sure that there's not a placebo effect and not a training effect, but actually an effect from the product. So to have a control condition, you can do a few different ways, a lot of different ways. A couple of the ones I will talk about now. The first one is separate groups. So we have 20 participants, 10 of them wear the wristband, take the test every 3 days. 10 of them take the test every 3 days, but they don't wear the wristband. And so that would help us say, okay, it's not just the training effect. If we want to say it's also not a placebo effect, we really want them to be able to have the same belief in the treatment. So if we give somebody a wristband, they're going to be more likely to say, ooh, this is going to help me, I should be helped by this, than if we just don't give someone the wristband. So just wristband versus no wristband might not be a good enough control condition. And again, this all comes back to, who are you trying to prove this to? Give me 1 second. I don't know if you all can still hear me. Okay, can you all still hear me now, Jenny? Okay, good. I just got a note that my AirPods connected to my computer. So thank you for your patience on that. So it might not be that the, right. So what I was saying was that it depends on are you trying to just prove to yourself internally this works, or are you trying to have a very rigorous scientific study? Both are valid paths, but you just have to decide who and how rigorously are you trying to prove this to. So if you really want to be rigorous with this, instead of just doing wristband versus no wristband, you can do a sham condition. So everybody gets a wristband, only half of them work. And the other half still vibrate, so people think they work, but they don't vibrate in correspondence to their actual balance, for instance. So this would be a very good way to say, hey, people are better balanced. It's not because they were taking the test every 3 days. It's not because they thought they'd get better, because half of them had the wristband also. They would have thought they got better, but it didn't get better for them. Of course, if you do see that both groups have improvements, then you know, okay, it is a placebo effect, or something else is going on here. So it's very insightful to have this. You also don't have to do a group of control and a group of experimental. You can do just a single group. Here we go. So the same participants. So one way to do this is a washout period. So maybe you have one group have, just a single group, but for 1 week they use the wristband and 1 week they don't use the wristband, and you measure before and after each of those weeks. And then you can see, were they better when they did have the wristband versus without. And so this way, if you have 20 participants, you can have experimental data for all 20 of them. So there's some downsides to this, but one of the upsides is that you have more people actually using your treatment. Or you can have them use the treatment the entire time instead of switching on and off, but then have them do this test where they're balancing for 5 minutes without the wristband and 5 minutes with the wristband. But you have to think, is that right for what I'm testing? And it might be. It's not right, as it turns out, for the balance test, because looking at the literature, there's a lingering effect where your balance is improved after you use a sensory substitution device for a period of time. So if I did 5 minutes on, 5 minutes off, that's not that you would still see an improvement in that control test. So this could be right for you, but you have to think about it carefully. And then the gold standard, if you really want to make sure you're proving to everyone this works, is to do a double-blind study. These are fun. This is where I get really excited about science. So you've probably heard of this term, and what that means is that you have different groups, some control groups, some experimental groups, and the people in those groups don't know which group they're in, but you also don't know what group they're in. So in order to do this, you're going to have a third party assign the conditions to a group. So let's say we have 20 people. We say 10 of them are in group A, 10 are in group B. And then I go to a coworker who's not part of the science team, has nothing to do with the science. And I say, hey, can you randomly assign group A and group B to control and experimental, and don't tell me who's who. And then that person is going to ship off the wristband, and he knows if the wristband works or doesn't work, but we don't know. So there's no chance of us saying unconsciously or consciously, ooh, let's give this person a little more attention. Let's answer their questions more seriously because they actually have the working wristband. We don't know. And so that's a really good way to make sure that you're not unconsciously or consciously changing the results of the study. The other part of this is that you run the full analysis. You collect all the data, you run the full analysis, and then you reveal which group was which condition. So you might have at the end of 4 weeks, hey, group A, their posture got a lot better, their balance got a lot better, and group B didn't. But you don't know yet which one's the real group and which one got the sham. So it's kind of nerve-wracking, but hopefully you get what you want out of that. So this is a gold standard way to design your control conditions. Cool. And I'm flying through this, so if there's any questions, feel free to jump in now. Otherwise, we can take them at the end. All right. So the next thing I want to talk about is the participants. So first of all, how many do you need? There are good ways to figure out exactly how many you need. So you can do a power analysis. That's a little beyond the scope of this talk, so I'm not going to get into that, but you can look up how to do a power analysis. This involves statistically finding how many participants should be in your group so that you see an effect being a difference, a statistically significant difference in the data based on previous studies, based on what tests you're running and whatnot. That said, if you are not a huge statistician and you just want to run a science study, start with 10 to 20 and you can always change it. This is a very simplified answer, but much of the time, especially for a product that you hope works for most of the people who you're making it for, 10 to 20 should be enough. And then you can always run a much larger study later on, but it doesn't hurt to start here. Any smaller than this, it's going to be a little bit tricky. So if you only have 5 people in each group, that's maybe not even enough. So if you're splitting into a control and experimental group, 10 probably is too small. 20 might be good enough where you have 10 people in each group. So that's a simplified answer. Do the power analysis if you want, but again, there's nothing wrong with just trying a smaller number. You can always run a larger study later. For recruitment, there's a few ways that I'd recommend doing this. Again, thinking here as a small team rather than an academic institution. So you can run online ads. Those are relatively cheap. So you can just put ads up on Facebook and Google and whatnot. You can target. So if you're working with a specific population and you know that they are all this age or whatnot, online ads, especially on social media, are a great way to target the correct folks. Reddit communities can be good. So subreddits are a nice built-in way to find, if you're looking for people with balance disorders and you're not part of an academic institution that has already a list of all of these people who have come to them, you can post on a subreddit for balance disorders. You can go old school and put flyers up. That's worked well in the past. There are websites for this specifically. So prolific.co is a good way to find participants, especially if all you're doing is running a questionnaire. If all you want to know is information about the general public and how that might work into your product, then you can easily send out questionnaires on websites like prolific.co. Or you can go on the streets and just do it like that. So especially if you are just doing internal testing. So when we were doing psychometric testing to see how many levels of vibration can somebody feel with the wristband, instead of taking weeks to recruit people with online ads, we just went out to the downtown area in Palo Alto, California, and brought cash and said, hey, if anyone wants $5 to take this test for 5 minutes, that'd be excellent. And especially there with psychometric tests where most people have people's skin response is similar, less varied than a lot of folks, a lot of other tests. That's a great one to do just on the streets. So just remember that just because you are doing a scientifically valid study does not mean that you have to spend a long time recruiting and whatnot. You can do these quick and dirty tricks to try to get your valid results more quickly. One thing that you do need to remember, though, is to make sure that your sample represents your population. So what I mean here is your sample is the people who are actually in your study, and your population are the people that you are trying to describe. So so many studies are done, especially psych studies are done on undergrad students, and sometimes that's okay, and sometimes that's not okay, because the world is not just a bunch of undergrad students. And so in the same way, if you put online ads up and you're getting people who are all on Facebook, if there's some reason to believe that that's skewing your results, and that if you were and that your actual customers aren't people who you're going to be reaching through this recruitment, that's no good. So just keep in mind that depending on what level of science study you're running, you want to make sure, you want to be extra careful to make sure your sample represents your population. So once you have the participants, you have the study design, you can start running the study. So a couple notes or thoughts on how to collect the data. So the first thing to think about is, are you going to be doing this remotely or in person? There's pros and cons to both, especially now. One of the pros to remote is there's a global pandemic and it's difficult to do anything in person. That said, in person has more reliability, so you know somebody is doing the test correctly, where you might be able to come up with a clever test you can send off to somebody, but you won't really know if they're doing it quite how you intended them to or not. Same with compliance. So if you tell people, make sure you're wearing the wristband this often, you don't know if they actually are or not if you're doing a remote test. But there is some argument that especially if you're testing this for the sake of a product rather than just solely for academic knowledge, there is an argument that having people test it in their real life in vivo is a good way to better generalize your results to how people will actually be using the product. So pros and cons to remote versus in person. I think that for small teams, I think that doing remote testing is great. There are specific times where you just won't be able to get away with it, but because of the lack of reliability. But you can just have so many more participants go through your study if you're able to send them everything remotely rather than having them come in and meet up with you. So that's what we do a lot. When you're actually creating these tests, make sure you're keeping it simple. So if you're doing questionnaires for your test, use online questionnaire tools. Don't overly complicate things. Google Forms is a great way to get that data into a spreadsheet really quickly, and then you can just quickly do a simple analysis on that. And so that's both for subjective tests and for demographics. So it is important to be collecting demographic data for any participant, because you might be surprised. You might find out that there is some slice of demographic that responds differently than another slice. And so this is just good data to collect. Then past the questionnaires, there are tools online for designing studies. So SciToolkit has some stuff built in. There are also other tools. And so I'm not sure if everyone on this call is comfortable coding or not, but there certainly are code-free ways to make interactive websites. And then also, if you do code, you can make a website, or you can make a smartphone app. So we use React Native a lot to be able to spit out iPhone and Android apps that we can then send to participants so that they can do these tests at home. So all we have to do is send them the wristband. You also need to think about data storage. So where is that data going that you're collecting? Maybe it's going on a device. So for instance, the balance module that detects their motion has an SD card on it. And so we can collect a bunch of data about how balanced were they day to day, minute to minute even, and store that on the SD card. And then at the end of the study, we can get that back and we can look, okay, how did they progress through time? And then of course, putting data into the cloud is great because you can look at it throughout the study instead of just at the end. So Google Sheets has a good API for getting data to plug into a spreadsheet. So we use that for the most simple projects. And that's nice because it's in a spreadsheet and it's easy to work with, and that's convenient. Firebase is a good, there's plenty of other options, but Firebase is a database that we use. So if you're making a smartphone app that can, or a website, either way, that can upload data to Firebase, so then you can download that into your analysis. Just a reminder to collect as much data as you can, so it doesn't hurt to include any aspect, even if you think that's not gonna correlate to anything, that's not gonna be useful data. You may as well put it into your database. So if you're asking people to answer a question, get the response time. How quickly did they answer that question? Maybe you'll find that that does have some implication into your results. So don't leave anything out. When it is time to analyze the data, you might be doing that in Google Sheets. Again, I just want to stress that your science study can look any way that best fits your needs. So maybe you're just outputting charts and you can quickly see, aha, like I didn't have to write a single line of code. I didn't have to do any statistical analyses, and I can see very clearly these two groups are different. So if you're lucky enough to have good data, then you might not have to do any statistics at all. That said, oftentimes you do have to. My go-tos are Python and R. Even if you're not comfortable coding, I think that I would go for Python, but I know that's R is very common as well. And R does have some more advanced statistics that are not yet available in Python, but that's quickly changing. If you're using Python, you can use Pandas, Seaborn, SciPy, Matplotlib, or different modules. Just putting those up there as a resource. SPSS is a graphical interface that people use in academia. It's super powerful. It's very good. And amazingly, there's a open source, I don't want to say clone, but software that's very, very similar to SPSS called JASP. And I highly recommend it. It looks like this. So you're dragging and dropping your data IDs. I know this is a small picture, but it has so many different statistical analyses you can run in there, and it outputs plots, it outputs just a whole lot of information. So especially when it's time to actually publish your data, you might want to go through JASP. If you're doing more simple analyses, either just doing it in Google Sheets or doing it in a Python notebook can be good. You do have to know what test to run. I'm not going to dive into that fully, but I will just put this spreadsheet up here. So there's lots of resources online to figure out what test you should be running. It might be that very clearly you should be doing a t-test or an ANOVA test or linear regression. And so all of these resources are online. Once it's time to publish your data, there's a few different ways you can do this. So maybe you don't publish it. Maybe it's just internal for you and your team, and that's fine. Maybe it's just internal data, but you still want to make a blog post about it, and that's fine. That's a fine way to go about this. Maybe you write a white paper where you're not going through a peer review system, but you are writing up all the details of your study so people can have access to that. So that's good. You have more details there, but of course the best way, what you want to strive for, is to get it into a scientific journal. That's going to be peer reviewed, which means that other scientists are going to be looking at your paper and saying, why do you use this analysis? Why do you do this? Why do you do that? We're not happy with this explanation. Can you add things here? So hopefully after a couple of rounds of revision, you'll be able to publish into a scientific journal. Unfortunately, many of them cost a lot for you to publish into, which is a little bit antiquated, I think, because the researchers pay to get their results published, and then anybody who wants to read those data, those papers, also have to pay to get access to the papers. So I'm not sure exactly where all the money's going and why this makes sense, but I think there are changes happening here. So there are a lot of fee-free journals coming out. So not only journals where you can access the papers that are published there, but also you can publish without paying a fee. And so here's a website that lists journals for a whole bunch of different scientific domains that are all free fee journals. So thankfully we are getting there. Okay, I'm just going to fly through the IRB section. So IRB means Institutional Review Board. So this is a group of people who decide if your study is safe for people to be in. So anytime that you are doing human research, you are legally required to go through an IRB. This, of course, came out of very terrible human experimentation in the past. So through a lot of evolutions of different protocols, starting at the Nuremberg Code, there have been implemented protocols to make sure that nobody does that again, and making sure that if you have people going into a drug study where they're testing out a new drug, is it going to be okay for them? Are the possible benefits of testing this drug outweighing the risks that it might provide to the humans participating? So it is good that it protects the human participants. I want to talk though about something funny here, which is that so it's legally required for human research. It's not required for, say, quality assurance, and there's certainly a gray area here. But if a company is, for instance, just doing user research, or if they're testing to see if their product is working as well as they want it to, they don't need an IRB. And so this is a tricky area, and I encourage you to read up on this. Research is defined as a systematic investigation that contributes to generalizable knowledge. And if you are, certainly if you're doing anything that's risky to a participant, it's best to go through an IRB. If you are testing a non-risky device internally, it can be okay to do that without an IRB. So look up more stuff about this. When you definitely need an IRB is if you're doing human research. So if you are doing research by that definition, that's the Department of Human, the Health and Human Services definition. So if you're doing research that involves humans, you need an IRB. But again, what does that research mean? That is a gray area. However, if you want to publish into a journal, they're going to want to see an IRB. So you'll definitely need an IRB in that case. And if you get a grant from, say, NIH, they're going to want you to go through an IRB. So it's not impossible. It is one of the trickiest things for a small group to do. There's academic IRBs. So a university will have an IRB in-house, but there are also out-of-house IRBs, for instance. WCG IRB, if you want to look them up, is a good one that lets you pay there. You don't have to be part of an academic institution. And it does cost a few $1,000s, so it can be a barrier. But one, the turnaround time is much quicker than that academic IRB. And two, it can let you publish your own science data without needing to be part of an academic institution. If you're going through an IRB, they're going to want to know the full study protocol, which is, how are you recruiting people? They want to see the actual advertisements you're posting, the emails you're sending. They want to know everything about the paradigm. They want to know the outcome measures. You'll also have to show them the consent form. So this is anything the participant will sign to say, hey, I understand this is voluntary, and whatnot. So they'll make sure that that is proper. If your study is minimal risk, it's very different than if it's not. So minimal risk means that you are not putting your participants in any more risk than they would be in their daily life. Probably a lot of what you all are doing and a lot of what we do is minimal risk, and that's up to the IRB to decide. But if they decide that it's minimal risk, then they might charge you less money. They might get you things more quickly, because you have to remember these IRBs are also approving studies that are surgical or pharmacological and are not at all minimal risk. So it's the same group that reviews all of these studies. So hopefully you can appeal to them and say, I'm not putting anyone into risk more than they would be in their everyday life. You also need to make sure that you are protecting your participants' confidentiality. So they'll want to know, how are you storing their personal information? If any of that personal information you're storing is medical, then you also have to go through HIPAA, which will define how you store the information and some other things. So make sure you look that up if you are ever storing medical information that's linked to personally identifiable information. And then also anyone who's on the research team needs to do a training certification that they give to the IRB to say, hey, I've taken the certification that says that I know how to work with human subjects. So there's it's doable. It's a lot of work to go through the IRB, but it's doable, and it's something you need to do if you're going to publish a paper. Just a couple of miscellaneous notes. One, run pilot participants. So before you run your 10 to 20 or 100 people or however many you want to run, get 2 or 3 and have them go through the study at least part of the way. Because they're bound to find something that goes wrong, some bug in your code or something. So that's super helpful. So this kind of gets back to testing everything early and often, including your tests. If you can go through a third-party researcher, that helps a lot. So for instance, for this balance device, in reality, we have done some testing on our own, but we also went to Stanford and said, hey, you have a balance lab. You have people who are already recruited to be part of your balance studies because they have balance disorders and they've come to you. You have IRBs that already cover the research we want to do, or maybe we just have to add an amendment to their IRB to say, ooh, and we'll treat these people with a wristband, et cetera. They have the test equipment, so they've got fancy things that help measure balance more accurately. And of course, if you can say, hey, Stanford tested this instead of us, our company, that's less conflict of interest and very trusted. So see if you can connect with a research group that would be excited to publish a paper with you. So for instance, with Stanford, they said, yeah, we have these participants, everything's lined up. We would love to have a paper with you all, and that's exciting research. And so yeah, just send us your devices and we'll take care of the rest. So if you can do that, that's easy. FDA, I'm not going to get into this too much, but if your device is mitigating or treating medical conditions, then you need to be FDA approved. This is another gray area. So for instance, hearing aids, of course, do mitigate and treat hearing loss. And so anyone who wants to sell a hearing aid and say it's for hearing loss needs to be FDA approved. But there are also hearing aids that are marketed towards hunters who want to be able to hear deer in the forest. They're very much just the same as hearing aids intended for people with hearing loss. But I'm saying this because there are, you can say, hey, this is not FDA approved. We're not trying to sell this to people with medical conditions. And especially as a small team, it might sink you if you try to go get FDA approval off the bat. And so you might just have to say, okay, we're not going to say this mitigates a medical condition. You have to be very careful to say that. But I mean, I think we've all used devices and whatnot, supplements that say this is not approved by the FDA. This, of course, is this and IRB are US specific, but there are analogs in every country. So look up that. Okay, just a quick review of what we've gone over. So just make sure you have a well-defined hypothesis and your outcome measures. Create a paradigm that properly tests those hypotheses. Code up your tests. Make sure you've got data storage. If you decide to go through the IRB, seek that approval at this point. Then recruit your participants. Make sure you're getting the right sample from the right population. Run those participants. Analyze your data however you want, and then publish the data however you want. And then also repeat the process. So you should be testing things and learning from your past test and running more. So it's a lot of information. I hope that was helpful. Are there any questions I can answer? Chat, I see. Andrew says, collect all the data. What privacy compliance considerations need to be done? Do you need to have recommended, or do I have a recommended resource guideline? I don't have a recommended resource off the top of my head. There are a lot online. Is haptic feedback of biosensors often going to be HIPAA? So with the caveat that that you'll have to make that call on your own, depending on the specifics. No. So the biosensors, you probably do not need HIPAA compliance to store that data because you can keep it unlinked from personally identifiable information. So if you are, if it is tricky, it is, and there are different views on this. So if there's enough information in that biosensor data that you can identify which person in your group, then you have to be really careful about HIPAA. So one way to think about this is, if I'm a third party, if I'm a bad actor, and I somehow get a list of the 10 participants in your group, and then I also get a hold of that biosensor data, can I link those two? Can I figure out, I'm pretty sure this person has this data. And if that's the case, if there's a good chance of that, then you have to be really careful to mitigate those data privacy issues and probably go through HIPAA. But if your sensor data is being stored and does not have a chance of identifying the person, then it's probably okay. Any other questions?
I have one for you, Mike, while people think of some more. When you're selecting participants, how do you recommend removing like your own team's bias or your own bias, or so that you're not starting off with a group that may be like, for a hardware device or a wristband, for example, that might be like, yes, this is definitely going to work for me, so that they've, before you've even started testing them, they've already got a placebo effect by signing up to be involved.
Right.
Do you have any suggestions around that?
Yeah, so first of all, having a control condition, especially a sham condition, is an excellent way to just take care of that. So if there is a bias there, both groups will be equally biased, and so it's less harmful to have that bias. That said, if you have an advertisement that says this is going to work and get somebody really excited, that bias will be there. So even though the bias is going to be even for both groups, you do want to remove that bias as much as you can. Now, this is another place where running a study as a company versus as an academic institution can be different, because it might be that you want to know that your population is people who see an ad and have that information and are excited to buy this. So sometimes it's justifiable to have that bias there. You just still want to make sure it's there present for both groups. Yeah, good question.
Can I have a question, please?
Mm-hmm. Please.
Hi, I'm sorry, it's a bit night at our place. So my question is, like, as you have some feedback, which is vibration or whatever. In case the device has, let's say, an electrical signal connected to it, this needs another type, or like FDA assessment or whatever. I mean, it needs another agency to assure that, okay, this device is valuable for medical use. And then if it's vibration, okay, it doesn't need this. Or also you suffered when you are building your MVP that you need to do some type of whatever type of medical assessment.
So the FDA cares about, when you're selling this, what are you telling people it does? And so it's okay to make a prototype from the FDA's perspective that is intended to treat people, and you're just testing a prototype. Then you don't need FDA approval. But yes, no vibrations or electrical stimulation, that doesn't matter. What the FDA cares about is, are you telling people this is going to help their medical condition? And if so, we want to make sure it does help them.
But also it doesn't care about whatever negative side it has. Like, for example, if the vibrations, if it's consistently repeating, it might damage a person, and we never tested that before for a long time.
Right. So the FDA would include that risk assessment in the approval process. So supplements, so vitamin supplements are strangely enough, not FDA approved. And it might be that some of them are in fact harmful, but because they're not claiming to help a medical condition, they are not subject to the FDA approval process. And so in a similar way, if you're selling something that does not say we are helping a medical condition, the FDA isn't going to touch it, even if it is harming people. That said, you should not sell something that that might harm people, and other groups may have something to say about it, but the FDA only cares if you are saying that. And there are people who are specifically FDA consultants, and so I suggest working with them if you are going to get FDA approval, or if you're considering it. But that's the general story.
Okay, thank you.
Hmm?
But I mean, with your device, if I may ask, for the vibrations, you never put a hypothesis that, okay, I'm sorry, of course, I'm just speaking very generally, so I'm not affecting the device, but I'm just discussing any other device or whatever. Like, you never put the hypothesis that such vibrations might harm people.
So we do, and there's, how much are you going to test that? And so the first thing we did was wear it ourselves. And so if it was the case that in everyday use, feeling these vibrations that often during the day would somehow injure your wrist or mess up your brain or something like that, you can always test it on yourself first. And that's what we did. Does that answer your question?
Because I mean, it might not affect you, but it might affect another group of people.
Right.
So it might harm another group of people. So did you make a test not to test the MVP, but to test any negative side effect?
Yeah, so we have taken that into consideration for different tests. But I think that the hypothetical you're saying of maybe the vibrations could hurt a different group, but not us. If we had any reason to believe that to be the case, we would have done extra testing to make sure. But instead, we don't have a reason to believe that that would be the case. So instead, we just include that in our tests with those groups.
Okay, thank you.
Yeah, thanks for the question. Anything else I can answer?
There's just one more in the chat from Andrew about if you have any recommendations. Oh, no, it just disappeared. Oh, yeah, sorry. Do you have any recommendations for steps before writing the protocol for a study? If we're at the early stages of this process and we're testing group members before the actual study begins?
So certainly doing a literature review, doing user research to figure out what is it that we're actually trying to make. But besides those, no, writing the protocol should be an early step. One thing I didn't talk about in this is a really good practice that's becoming more common of publishing a paper that is just your protocol. So it has no data collection, but it's parts of what will be your final publication. But you tell everyone, hey, this is exactly what we're going to do, and we haven't started it yet. But no, nothing that happens before the protocol, besides user research, whatnot. So I see a few more here. Yeah, Andrew, thank you for expanding on the different FDA classes. Philip, have you any idea roughly how much private IRB approval might be for a low risk study? Yeah, so Philip, about in the low thousands, you might, if you look extra hard, might be able to find an IRB that does just low risk studies that charges less. But as far as I've seen, all of the IRB groups are certified to approve all studies. And so that's why a lot of their processes are expensive, whether or not you're doing a minimal risk. But yeah, oftentimes a new study will cost 1 to 2,000 if it is minimal risk, and then amendments to that study can be a few hundred. And then there sometimes are a few hundred dollar single costs for getting things set up. So yeah, I'd say in the low thousands. Yeah, any other questions? I know we're just over time, so I want to say thanks everyone for coming in and listening. And of course, if any questions do come up that you don't have right now, you can always send them over to us. We also have a Slack channel for the developer community that I'm sure many of you are on, but if you're not, that's a great place to ask questions and get answers as well.
Awesome. Thank you so much, Mike, for your time, and thank you for everyone who's attended. Like Mike's mentioned throughout, but this event is part of the Neosensory Community Research Program. So if you want to find out more about that, I've dropped a link in the chat along with a link to our developers hub on the website and a sign up for our developers Slack. So please come along and ask any more questions. And yeah, that's it. Thank you so much for coming.